Today marks the 12th year of Autism Awareness Day, and new research suggests some kids with autism spectrum disorder are prone to wandering off. It's a phenomenon called elopement. A place called the Center for Discovery is creating algorithms that can hopefully anticipate when kids with ASD will wander. The center offers care and access to research for a wide range of complex conditions to over 1,200 children, adults, and families annually.
Our guest is Dr. Theresa Hamlin, Associate Executive Director of the Center for Discovery, and she joins us now. Thank you so much for joining us,
Thank
Doctor.
you for having me.
First off, before we sort of get into what your center's been doing and looking into, let's just talk about autism, because
Sure.
I think that, when people talk about autism, still, even though there's a lot of awareness, they don't really understand what that means. There's such a range in the behavior of children who have been diagnosed on the spectrum. It's called on the spectrum for a reason, that people might not really understand what autism is. So how would you define it?
Sure. Well, from a clinical perspective, autism is diagnosed through observation, and there is a thing called the DSM-5. So there's certain criteria that one needs to meet in order to be diagnosed. So there has to be significant delays in social communication, and then kids often have these repetitive kinds of behaviors, or they don't interact like typical kids do, and then they can be diagnosed. But the real problem is that autism is a highly complex disorder. So the DSM really doesn't do it justice in terms of all the other problems, especially the biomedical problems, which are often not addressed. So kids have sleep disorders and gastrointestinal problems and seizure disorders, and all of these things go along and make the autism so complex and really difficult to treat. Yeah, so that, that's it in a very
Yeah, no, but that's important. And I think one of the things you and I were talking about earlier is that it feels to me, and I'm not a parent, but it does feel that we've begun talking about autism a lot more in the last 10 or 15 or 20 years.
Sure.
And it wasn't as common, or it wasn't a common as subject. You never saw it in news reports the way that you do now. Are we seeing an increasing number of people being diagnosed with autism over the last couple of years?
Absolutely, there is no doubt about it. I've been in the field for 37 years, and really what we're seeing right now in terms of our referrals are more 4, 5, 6, 7-year-olds, more than we've ever seen before. So not only is it 1 in 59 right now, that number could be going up, based on the number of kids that we're seeing. But really over the last 2 decades, you're right, that's when we started to hear more about autism.
That breaks my heart and boggles my mind that a child could go until they are 5 or 6 or 7 and not be diagnosed, that no one would consider autism as an option for their behavior or their social issues.
Sure, let me correct that though. So they are probably already diagnosed, most of them. They come to us after coming out of a preschool program, but they have really complex forms of autism. So the kids that we see have lots of behavior problems. They have the sleep disorders. They may have that wandering behavior where school districts just are not comfortable yet treating these kids. So they're coming to a highly specialized center like the Center for Discovery.
So that's what you guys have been looking into. You've been looking into something specific, kids wandering off. And we've seen some high-profile cases here in New York where, a child, exactly, wandered right out of the school and disappeared.
Yeah.
Right?
We look into a lot when it comes to autism because it's not really well understood. So we have a huge corpus of data. So we collect information on all of our children. We have over 360 individuals who actually live at the Center for Discovery, and then we have a huge day program and clinical program. But we gather as much information as we can. We have really good data scientists on staff, and we're looking at, what are those behaviors that can result in death? And certainly elopement is one of them. And so typically when you read the literature, somebody says, or what it says is that kids like to run away from things, or they're trying to avoid something. And so you have to have safety plans in place, and absolutely you have to have safety plans in place. But it could be more than that. And that's what we're finding, that there may be other correlations, such as severe gastrointestinal problems, so that when kids are constipated, which is often the case in autism, if they haven't gone to the bathroom for several days, they're more likely to run away during those days than when they've just had a bowel movement. So we need to understand more, but those are things that you can treat. And we need better treatments. We just don't have enough yet to really help families and help children. So that's what we're all about, really going after the science and trying to understand this highly complex disorder.
You've probably become aware of recent studies and reports of parents who are afraid to give their children vaccines because
Sure.
they believe that these vaccines lead to autism. And the spread of this has, we've seen an increasing number of people that believe in this, and we can see direct results now. Measles outbreaks that are happening right here in New
Absolutely.
York State in Rockland County. They've
That's
gone
right.
into a state of emergency
That's
in a
right.
county in New York State because of a measles outbreak. How do you address that? What's your reaction when you hear that parents are unwilling to vaccinate their children because they think it leads to autism? Is that why we've seen an increase in autism? Just to dispel the myths and the rumors.
Yeah, I mean, so our heart goes out to all families who are trying to figure out what's going on. And the truth is, nobody knows, but we need to follow the science. And there is clear evidence that that autism is not caused by measles. And at our center, we have very, very medically complex children as well, and some of those are kids with autism. If they were to contract the measles, they'd be the first children to die. So 110,000 kids die every year of measles. And so we advocate that parents get their children vaccinated.
Just like one last question. I know with autism now, sort of the way of addressing it has to do with sort of a behavioral therapy, teaching the kids how to react differently to stimuli or whatever. Are you finding that there are other ways, other avenues that can also address autism? I find it really curious that you brought up the gastrointestinal thing.
Absolutely.
And maybe there are other things that maybe we haven't focused so much on.
Yeah, I mean, that's what our center is all about. So most of the kids that come to us have failed those behavioral programs and haven't done well, especially in their teenage years. So we look at what we call the Crossroads of Complexity, the biology, the behavior, and the environment. So we do full assessments on all of those issues. So we look at, the neurological system, the gastrointestinal system, the mental health issues in autism, the genetic aspect of autism, and then we also look at all those behavioral things. And then we look at the environment. Where are they living? What have they been exposed to? How are they being managed? All of those things add to this complexity. So you have to have a really robust program that can address those issues and really treat these complex kids. And that's what we do at the Center for Discovery. We're a Center of Excellence for New York State. We're nationally recognized, internationally recognized, and it's just a great place, and we're the only ones doing it. And so that's really the message. We need to have other places like the center because parents need help.
Yeah.
Kids aren't getting better a lot of the time, and they need help.
Fascinating. Thank
Really
you so much,
fascinating,
Doctor.
Doctor. Thank you very much.
Really happy to be here.